Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain, because here, you are both patient and physician.
Yeah, hi, I'm Dr. Tim Laird. I'm a family doctor. I serve as the Chief Medical Officer of Health First Medical Group in Melbourne, Florida. And you're asking for me to describe the future of medicine from my perspective. I think the future of medicine is very bright. I've got actually 2 daughters in medical school right now. And compared with 35 years ago when I trained, our ability to diagnose accurately, our ability to treat well. I mean, I trained before really you had any access to computers, Google, internet, AI, robotic surgery, that sorts of things. It's just really limitless. I see some medical students nervous about the future. They shouldn't be. Everything is getting better. People are concerned about lack of autonomy because of the increase in employment of medical doctors. Well, I'll tell you, having been in private practice and employment, there are struggles in both. And you just have to fashion the kind of work-life balance that you want and go after it. Just remember, you're incredibly talented as a physician or upcoming physician, and the ability and your ability to help humanity has never been brighter.
Hello, hi, it's Seema Bajaj. I'm with the Seleni Institute, which is a maternal mental health nonprofit focused on women's mental health. The patient physician means one where the physician is listening to the patient and the family, building trust, building that relationship, and the physician has time to do so. The future of medicine is really going to be with women, with children, with investing in women and mental health, and the future is really caring for the whole family and creating that trust within a family, and that the entire family is cared for, and it starts with the mother and the woman. I think it's important to bring back the joy for the physicians, to bring back why they are in the field that they are in. I believe that there's a lot of rush and there's a lot of regulations and compliance that overshadows what the physicians really are meant to do. And the physicians are really meant to care, to take the time to provide empathy, to provide support, to provide guidance for these patients and their families. And that's what really is needed. And that is really what brings the joy into the profession. So the Seleni Institute is a training institute. We provide trainings for healthcare professionals. We are always trying to close gaps in curriculum. Our focus has been on perinatal mood and anxiety disorders, and of recent we have dedicated time to communication for patients and families from physicians, teaching physicians how to better communicate and build that trust. Honestly, the energy has been awesome. People have come by. People are interested. People want to learn. It brings back to the meaning of medicine. People want to figure out what to do next and to feel good about what they're doing.
Hey there, I'm John Casey. I am the Program Director and Director of Osteopathic Education at Ohio Health Doctors Hospital in Columbus, Ohio. And I'm going to share with you how I find or create meaning in medicine. So one of my absolute favorite things in medicine, of course, is the healing relationship that we establish with our patients. However, for me, there is also a second part which in medicine gives me additional meaning and really makes my job the most fulfilling in the world. And that is the opportunity to work with physicians in training. So as a residency director and as a DOE, I get the opportunity to help shape the future of medicine. So any physician that practices medicine is really, in my mind, a superhero. Even if you just start residency and only see a few patients and your career is done, you've probably touched more lives than a lot of other people just in going through the training, right? And by the time you're a practicing physician for 1, 2, 3, or 4 years, you really have had an impact on a great number of lives. And that's a great feeling for me. But I always noticed that I wanted to have a little bit more. And I love teaching. I love sharing things that I've learned. And that can be done with patients, but that's almost always, unfortunately, a lot of the same thing. What I find meaning and passion about in medicine is when I have a resident that has a new situation, a new problem, a new perspective, a different insight, a different background. It really energizes me because seeing how they are developing their own passion for medicine is what really inspires me. So I create meaning in medicine by helping create the next generation of physicians. And my true meaning comes from the deep importance that is shared when you are helping another person to help their patient. I find it the most rewarding aspect of medicine. I think it will dramatically increase my longevity in medicine. And for any of you that are out there that maybe feel a little tired or burned out or are looking for something, take on a student, take on a medic student, mentor someone that is from the community that wants to go pre-medicine, reach out to a local university. Just that small little bit of mentoring and teaching can absolutely change your perspective on your workday when you show up. That's how I found meaning in medicine.
I'm Dr. Amy Matecki. I'm a physician from Sutter Health, Alta Bates Summit Medical Center, where Berkeley, Oakland, Bay Area, California. I've been creating meaning in medicine for the past 20 years. And I started after I graduated as one of the chief resident. I was recruited by a group oncologist in Berkeley. And what they were looking for, because I have dual degree, which is Chinese medicine, and also Western medicine, which is internal medicine. And the Chinese medicine, primarily, they will look at acupuncture. And also, they don't know the safety on patients, because where I was, Berkeley, is a lot of patients interested in alternative. So the oncologists say, we don't know what they are taking, the tree leaves, barks, so maybe you can help us watch for safety. So I stumbled into the oncology, didn't even know what's the profession I was getting into it as an internal medicine doctor. But for the past 20 years, I have to say, it's very gratifying. And also I watch how my colleagues, burned out. And so I created a very rewarding wellness center for nursing staff, also for patients, for 20 years. So it's a word by mouth, never really advertising. And then I got involved with education because I cannot treat every patient. So I started getting involved. Who should I refer, or patients will call, which acupuncturist should I see? And that's where I started a training program as a public hospital 10 years ago. And then after COVID, we started here at the Sutter Health East Bay Alta Bates Summit. So we bring the acupuncturist to side by side with the physician with us to taking care of the patients in the hospital. We started with the cancer patients, and we expanded to rehab for stroke patients. And now we are, just this year, we expanded to OBGYN, which Alta Bates, we are well known for OBGYN department. So we help prepartum or postpartum and antepartum for pain management and anxiety, stress reduction for both nurse and patient. So that's where I would say we created an environment for patients to come to our clinic, and also in the hospital, we want them to feel they are being cared. And also we help our staff, nursing staff or ancillary staff. We have a lot of hospital employees come to our program to get cared for chronic overused condition, help them recover fast, decrease the disability possible. I don't have the data. Don't ask me the data yet. No time to do the research yet. Also, we did acupuncture research program for intensive care patients.
I'm Louise Tetro. I'm from UMass Chan Medical School's residency program for ophthalmology. What does the patient physician mean to you? Well, it strikes me that I would love to see a patient's physician, a physician who wants to be with the patients and making a difference every day. I guess that's where you also find your meaning in medicine, because medicine wouldn't exist without people connecting at a very vulnerable time in their life, where they need someone to be with them and to guide them to making decisions, sometimes life or death. And you also need a patient physician who's going to be able to sit there and listen and take the time that that person needs.
Dr. Wendy Shevar, BB Healthcare in Delaware. I think the future of medicine is going to kind of take us back to a more personalized approach where the caretaking is going to be relying on the medical perspective, so people are going to look for long-term connections with their physicians as we become more ostracized as a society and more isolated. I think people are going to return to that desire to be more personable. Also, I believe that we're going to be having to connect with AI and technology, and we're going to have to use some of those advancements in science to encourage and support the new growth in the future of medicine.
My name is Candyann Humphreys. I work for the Kurt Kerkorian School of Medicine at UNLV in Las Vegas. Wellness is so important because we have to take care of the people that are taking care of us. We need something to give them some downtime, remember that they're human, and that they can have fun. That's kind of wellness for me in my institution. Finding something where they can take a break from all the serious head and neck cancers and everything else that they deal with on a regular basis. So as a residency program coordinator, I try to find all the ridiculousness. We've done things like bowling and axe throwing. We've done ski retreats. Sometimes it's just food at one of our houses. We do Friendsgiving, which was really great. We had all the residents with families and pets. Everyone brought their pets, which is a great part of wellness because they're just as important to us as our kids sometimes. We do baking, and I think we do a lot of food. Food is a lot of wellness. Then they need to go and run around the hospital for 80 hours a week in order to work off all the food. So it's basically just coming together to remember that you have people that support you as you're going through residency. Practicing what you preach is a little bit harder. I feel like for me, doing what I do, the wellness activities are wellness for me too. I really enjoy coordinating the events and the various things that we do. That's my joy. And I don't need the thank you, but getting the thank you back from them, hearing how much that they appreciate it really, really works for me. This conference right now, it's work, but it's a wellness trip for me. I've never been out here to Orlando, so I get to experience new things. I take a day and see the sights. I meet new people, experience new events, and that's kind of the wellness for me.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects Podcast Network. Please email questions or show ideas to info@physiciansrs.com.